Okay, good afternoon, good evening, depending on where you are joining us from. And welcome to today's first GHQA webinars. Um, so for those who are new, and thank you very much for joining us. And let me just give you a short overview about the GHQA. So the Global Health and Quality Alliance, it's a nonprofit organization with a goal to advance public health, patient safety, quality improvement, innovation, and equity. So we are currently connecting health professionals from different backgrounds, institutions, and advocates across disciplines and just from around the world, so that we can together we can identify health disparities among different communities around the world, and so that we can actually address those public health issues through collaboration, advocacy, and education, just like what you are currently doing today. We are currently represented in uh, almost like 20 countries. And if you are new and want to be part of this movement, so you can join us for free at the ghqaconnect.org. You can also contact us. There's an email address there. You can visit the website and just learn more about what we do and how you can be part of this movement. Um, as part of our educational activities, so we just launched, and today's the first date that we started the webinar. So we'll be having like webinars on different public health topics, and where, we're going to invite public health experts just to inspire solutions and actions, and so that we can learn more and be proactive and just help different communities. And so as for today, we're going to focus on climate change and health. And it's my privilege to introduce our distinguished speaker, Dr. Leah Werner. She's a physician, epidemiologist, public health leader, and health equity advocate. Her area of focus are family medicine, Medicaid program development, climate change, and health. She's an assistant professor at Oregon Health and Science University. She's also a medical director for an integrated delivery system program that serve over 60,000 underserved communities or population in her state. And she's also the director and founder of her company, Werner Health Consulting, LLC, and she's also the director for primary care and climate change and health program at her university. Please join me in welcoming Dr. Werner for today's GHQA webinar. So, Leah, you can take over and start the presentation.
Hello. Thank you for such a nice welcome of me. I feel much more prestigious in this space than I do in real life, and I do sleep, I promise. Let me share my screen to get started. What I will say is that there was a lot of information that I wanted to present, and I know I don't have more than an hour, so I really struggled to contain it. The slides are very, very busy. I would love feedback. And I will also say I am presenting this from an American perspective. And as I'm presenting this to people who don't live in the United States, I would also love feedback on how to more accurately and truthfully present the information that I'm sharing from my perspective on what are the impacts of climate change and health outside of North America. So I've gathered the facts as best that I can, but I think that I can do better. And so I'd love to get feedback from people after the presentation so that we can make this webinar as strong and truthful as it can be. So on that note, I'm going to go ahead and share and start my slides. Okay, and let me get this into presentation mode here. I can get this going. There we go. All right. So everybody can see this okay?
Yes, great.
Yes, we can see.
Thank you. All right. So the future of healthcare lives in your communities. And this is based on the work that I am doing in rural areas of Oregon. But this work is also written about extensively globally on the importance of community healthcare workers, also called traditional healthcare workers, and the role that they play in holding their communities together and improving health outcomes. All right, so the learning objectives for this hour are to summarize the regional climate health threats most relevant to different parts of the world, explain why, in my opinion, large healthcare systems, academic medical centers, and hospitals are not the place to solve these issues or the primary defense against climate-driven health threats, to describe how community-based strategies protect health more effectively, and how to identify cross-sector partnerships that enable the scaling of local solutions to be more generalized and potentially impact globally, and then translate or implement these lessons into actionable steps for communities. So I'm trying to take this and make it a global framework rather than focused primarily on the Pacific Northwest of the United States, which is where I live and do most of my work. And so I have these generalized top climate threats by region, and I will get into those in more detail. So this is just a great summarization of where I'm headed. I won't bother to read these through this slide, but I'm hoping I can share slides and they can be read. So starting with the largest continent on Earth, Africa. So we're going to go through some of the top climate threats to the region, which is extreme heat and desertification, loss of natural habitat forest. Rapidly rising temperatures are expanding arid zones and intensifying heat stress across a huge swath of the eastern horn of Africa. With this comes drought and water scarcity. So we've got more frequent prolonged droughts, declining rainfall. So the reliability of rainfall seasons is disappearing. We've got groundwater depletion and transboundary basin stress. And at the same time, as the rainfall becomes less predictable, the earth becomes less capable of absorbing water. And so when the rain does come, it often precipitates into flooding. So you get heavier downpours, which we also experience in the Pacific Northwest. We call them atmospheric rivers here, where you have a level of waterfall that is just above and beyond what we're used to receiving, and the earth can't absorb it, so it leads to flash floods, heavier downpours, river floods, not to mention the tropical cyclones in the Mozambique Channel, the coastal erosions, and inundation of the Nile Delta in West Africa. Food systems become unstable with these extremes of heat, drought, and erratic rainfall. So you have crops, livestock, and pastoralism that's under threat. So the climate variability reduces yields and pasture quality. Livestock are undergoing recurrent heat stress, just the way humans do. And there are certain organ systems within humans that are threatened by recurrent heat exposure. Primarily, the kidneys are most vulnerable to that, but mammals also experience renal injury, which can lead to chronic kidney disease and renal failure, leading to cardiac disease in the livestock. So their life expectancy goes down precipitously. And then you have the rangeland degradation threatening food security. And with this, we also have vector and waterborne diseases. So areas where we had mapped where vector-borne diseases would have been are now expanding. And so the vector-borne diseases, particularly malaria, dengue fever, chikungunya, yellow fever, and diarrheal diseases are expanding. And in terms of yellow fever is not traditionally endemic to parts of Africa. It has been brought in by travelers into Kenya and has expanded down into Tanzania. Both countries have tried to really mitigate the risk of growing yellow fever threat by requiring travelers to have yellow fever vaccinations, and I think that that has been effective. But it's a huge bummer that it's there to begin with, on top of these two countries trying to deal with malaria as an issue, especially for their children. You have urban vulnerability in informal settlements. So within urban areas, there are heat islands, and that is a whole man-made ecosystem in and of itself that probably needs to be its own separate lecture. But within the urban vulnerability, particularly if there isn't civil engineering and planning, you can have flash flooding, sewer system drainage issues leading to more disease and sanitation challenges, and it's basically amplifying health risks in rapidly growing cities that are not well planned. And then this also is affecting energy, hydropower, and grids. So the drought lowers hydropower reliability. Heat will strain the electric grids, causing brownouts or blackouts. And then you have storms and floods that damage transmission and generation assets. Ecosystems, biodiversity, and wildfire are under stress and changing. Coasts, fisheries, and water quality are under threat, particularly from harmful algal blooms that threaten fisheries and food safety. And within this, as resources are being stressed and health risks abound, we struggle with equity, conflict, and mobility. So climate stress on water, crops, and jobs heightens inequality, displacement, conflict risk, with cross-border ripple effect. Asia, some of these eco-climate threats are the same globally, and so I won't expound greatly upon each place, especially if it's redundant, but the primary risks throughout Asia are heat and drought. Asia is also a huge continent. So there's a vast ecosystem and micro ecosystems that are changing, but if you're looking at South Asia, heat and drought are pretty severe. There's more frequent heat waves, worsening drought, and desertification of the South, West, and Central Asia. Up in the north, there's glacial melt, sea level rise, flooding, particularly in the Himalayan and Tibetan glaciers. They're retreating. Megadeltas are at risk. Monsoons are becoming more extreme, causing floods and shortages. With this, again, also shifts in rainfall and unreliability of rainy seasons. So the rainfall and snowmelt are disrupting farming, washing away villages. The deltas are becoming more salinized, and so the water quality is changing. And there's severe water stress in Central and West Asia because of this. The climate-sensitive diseases, so vector-borne diseases particularly, are also expanding the same way they are in the continent of Africa, where you're seeing malaria up at higher elevations than previously, along with dengue and then cholera, because of the water issues and inability to maintain water sanitation during floods. So floods are definitely worsening waterborne illnesses and making potable water and safe water for people to drink and bathe a challenge during extreme weather events and thereafter. Stronger cyclones, landslides, permafrost thaw. This is putting urban areas at risk, particularly in the north. Megacities within Asia are facing major flooding with also heat island stress. This is also putting pressure on their infrastructure and economy, hydropower declines, disruptions to agriculture and fisheries and supply chains, and the infrastructure is under stress. And this is also leading to inequality, migration, and security issues. North America, where I live, we also have, I'd like to really, I probably should have put a slide in here about Köppen-Geiger climate zones. So it's how we classify what climate zone you're in. And so there's, an example would be tropical, subtropical, temperate, continental, arid. And so all of these climate zones are throughout the world, but what we see in North America, we have all of these climate zones present. And within some of these climate zones, these extreme weather events are more dangerous and problemsome, and then they happen in fits and spurts in northern areas. But because these northern areas are not acclimated to extreme heat, for example, when it does happen, it can actually be even more deadly because people are not acclimated to that kind of heat, and so their bodies and their homes are not prepared to sustain the stress of heat like that. So that's kind of what we're dealing with more in North America: extreme heat and then longer wildfire seasons. So the West burns. It's always burned, but our wildfire seasons are now 100 days longer than they used to be. And the toxic smoke is incredibly dangerous for human and animal health. But there's also the risk of people burning up from the wildfires themselves, which are often sparked by humans living in areas where they shouldn't be and not managing the forest properly. We also have lightning strikes, but the lightning strikes are fewer and far between than human-initiated wildfires. We are also experiencing drought, snowpack loss, water scarcity. We have stronger hurricanes in the Gulf and the Atlantic. And as I mentioned, atmospheric rivers in the West, where the amount of water that comes down with one rainfall is just overwhelming, and the earth cannot absorb it, leading to floods. We are also having an expansion of vector-borne diseases and seeing things like West Nile and dengue up in northern areas where it had never been before. And then harmful algal blooms, which I have one of my colleagues on the webinar who is dealing with that in the Midwest around the Great Lakes. And then this is leading to health and equity issues within North America as well. Also, our food and fishery ecosystems are under stress. Our North America extends up into the Arctic, and I do have some slides later on the Arctic and polar regions, but there's rapid warming, permafrost thaw, and also wildfires in the boreal forest. And the media focuses intensely on the carbon sink that is tropical forests, but actually the boreal forest is our largest carbon sink. And when that burns, the theory is it's even more catastrophic than deforestation of the Amazon or the burning of tropical regions in Indonesia or other parts of the world. And so our boreal forests are under great threat right now. And then we also are dealing with our energy infrastructure and economy issues around extreme weather events. South America is facing a lot of the same things. So rather than being redundant, I'll just show you, I'll highlight just the points of interest in this region. Amazon deforestation and ecosystem loss is catastrophic. That has slowed down with the new administration in Brazil right now, but under Jair Bolsonaro, we saw more destruction of the Amazon than in the previous 30 years. And that was very, very catastrophic for the earth as well as for Brazil itself. There are also wildfires in areas that we really hadn't seen a lot of wildfire activity before, including the Pantanal in Brazil, which is a marshy area. And I think of it more as filled with alligators and swamps, but it's drying out, and it's areas of it are under threat for wildfires. Amazonia as well, parts of the Amazon burning, which is an also unusual occurrence. And then in the Andean foothills heading towards Argentina and Chile. Urban vulnerability, South American cities, especially in Brazil, called favelas, are just sort of built where people can build a house. Again, there's no civil engineering, there isn't planning or construction, and eventually electricity or eventually plumbing will make its way into those cities and into those places. But the houses are very vulnerable. They don't have solid foundations, and with heavy rain, there are mudslides, and the favelas often just slide down right into urban Rio de Janeiro, Sao Paulo, and there's loss of life, and it's very catastrophic. And at the same time, also suffering from the expansion of vector and waterborne diseases into areas and into altitudes where previously they hadn't been seen. And with this comes the social and economic vulnerability. Europe, of all places, is a very small continent, but it's probably facing in some ways, the most extreme climate catastrophes of all parts of the globe. There is extreme heat hitting Europe that is above and beyond what this continent has previously experienced, and people are not prepared for this. And the housing, hundreds of year old housing that was really built for colder climates, is trapping people into hot houses with no place to go and no air conditioning. And so the continent experienced catastrophic loss of life, often with every heat wave that occurs there. And with that, there's drought, water scarcity, also wildfires, followed by flooding, storming, and flash floods in certain regions. There's sea level rise and coastal erosion, and glaciers are retreating. I don't know if people were aware of a whole village in Switzerland that was just decimated by the loss of a glacier. Death of a glacier, and the village was buried in a mudslide because of that. So Switzerland is having to map and deal with areas of risk within the Alps because of the glaciers retreating and collapsing. And this is really affecting a lot of the economic viability of many areas that rely on their food, forests, and fisheries. And then as well, there's an expansion of health and vector-borne disease. Europe is also dealing with water quality issues and harmful algal blooms. And in terms of the algal blooms, this is really something that is precipitated by fertilization practices, which really feed algae, and the lack of movement in the water. When bodies of water are dammed or there's lack of movement, and along with fertilization, your risk of algal blooms goes up precipitously. And with all of these things that I'm talking about, this is sounding like a very doom and gloom lecture so far. We do have the capacity to address these issues but I think it really requires like a much larger force than local communities. It requires the government and the globe to buy into this. But for every issue that I'm talking about, we do have the capacity to mitigate these threats and to work together to protect human life and the ecosystem. Oceania is the whole South Pacific, from Australia to New Zealand and all of the islands around there, south of the Philippines and Indonesia. Australia just came out with its own climate report, and the extreme heat, bushfire, and flood risk is pretty sobering of what they're looking at, especially the mega fires that Australia is dealing with, and areas of really prolonged drought that are making some parts of Australia essentially not habitable by human beings. Southern Australia and surges along the Pacific and in New Zealand are much more intense for flooding, storms, and cyclones. Sea level rise is actually erasing certain island nations. They have nowhere to go. Their homes are sinking. There are also marine heat waves within the ocean itself, harming the reef, Pacific reefs, changing the ecology and making the human relationship with the ocean very stressed. So fisheries, food security, and water quality are also under threat, particularly with the warming of the ocean in the South Pacific. And this is also leading to health inequity issues where people are struggling with heat illness, smoke, ozone exposure, waterborne disease, vector-borne disease, and then impacts on culture and traditional ways of living. So there's displacement. Entire nation sovereignty is at risk for some of the island nations, energy and infrastructure issues, And then we also have glacier retreats in the New Zealand Southern Alps, increasing rockfall, landslide risks, and the decimation of villages in those areas. And then the Arctic and polar regions are really, they're almost the bellwether, or the canary in the coal mine, as we say in North America, which is when the canary stops singing, we know we've got carbon monoxide in the mine, and we're all at risk of dying. The polar and the Arctic regions, Antarctic regions, have been experiencing the threat of climate change far sooner than the rest of us have felt it. There's rapid warming and changing of the seasons that is really profound. And what I experienced in my residency training in Alaska was I would have liked to ignore climate change, but it was impossible to ignore that it was happening in Alaska when I was training there. And that's part of what put the seed in my brain that this is a huge threat to human health and to our planet, and to try to do something about it. Sea ice loss. There have been native villages that had to be relocated because they're sinking under the Bering Sea, or the tundra, which is the land that is not forested but looks like marsh. That is really held up by permafrost. The permafrost is thawing, and with that, the land is becoming uninhabitable. You cannot build on it. Everything sinks. And with that, the permafrost is leaking methane gas, which is basically an accelerant to climate change. It's warming the atmosphere even further. And very ancient, primitive infectious diseases that live in the permafrost are thawing as well. And so in terms of pandemic risk from what's coming out of the permafrost, that's a huge threat that we still don't fully understand yet. Coastal erosion and community relocation. So there was one native village that we were watching closely when I was in residency, and it's finally been completely relocated, Newtok. Newtok is one of a handful of native villages that have had to be moved inland just because of the permafrost thawing and the sea level rise. And just the impact that has on cultures and communities that have to leave their home is huge. Ecosystems, fisheries and food. Alaska is a huge fishing area. So is all of northern Europe and parts of northern Asia. People rely heavily on the fishing there, and that's also being threatened because as the water is warming, certain animals that had been fished don't exist in that area anymore. So king crab was a huge economy booster for the area of Homer, which is a town in Alaska, and king crab hasn't existed in this area for over 20 years because of the warming of the water. So it's moved, and it's hard to locate it because the whole ecosystem is changing, and with that, the economy and how people can live. And so a lot of the same issues going on in the Arctic and polar regions as other places. I would say that there's an ocean current that has moved in a particular way around the globe for eons that we are aware of that may change its circulation patterns based on the warming water. And I don't know what that would mean for the planet, but it's something that's also being watched, and it's watched closely in the Arctic and the polar regions. So a really important word that I used previously is the word mitigation, which is stopping certain things from happening. And there's some things that are too late to stop. And so what we want to move to next is the concept of adaptation. What is adaptation? It's how we adjust to natural or human systems, to new or changing environments. And we're looking for exploiting the beneficial opportunities of the landscape that we're in, and then moderating the negative effects. Humans have been adapting for thousands of years. We are here because of all of the adaptations our ancestors were successfully able to do to allow for us to be here on Earth today. When we're thinking about adaptation in terms of climate, we're thinking about a very thoughtful, intentional adjustment to the new normal of nature and human systems, to new and changing environments, to exploit the beneficial opportunities of what's changing, and to moderate or to mitigate the negative health effects. There's a lot of disagreement about how to do that, but I think having the conversation globally, which we're doing that, is critical for the survival of our species. So what we're thinking about and what I learned in my training was this prevention framework for climate and health adaptation. Now, this was talked about very generally, but this is where, as a physician, I saw the healthcare system and public health embedded within this, because we use this kind of language in medicine, primary prevention, so preventing human exposure to climate-related effects. The only place that that can happen is at the global and government level. We as individuals or small communities, we cannot prevent human exposure to climate-related effects. They're already happening. They're happening everywhere. So if we were going to, and I think in many ways we've lost our opportunity for entire primary prevention, but if we were ever to get it together as a planet, we could really work on this and really mitigate human exposure to climate-related effects through adaptation and working on mitigation. Secondary prevention is reducing vulnerabilities of people exposed to climate-related effects. And that's where I saw my role as a primary care doctor on the front lines, living and experiencing with my patients the extreme weather events. This is a public health issue. This is a local government issue. This is a community issue. And this is where primary care physicians and emergency medicine doctors step in, is to make recommendations on what can we do to prevent our patients living on the frontline communities who may be medically vulnerable. What can we do to help them to survive through extreme weather events without being harmed? And tertiary prevention is, okay, people have been harmed and we got to treat them. So that's the healthcare system, that's the hospitals, that's in the clinics. And in that sense, we've kind of already failed because we've missed step one, primary and secondary prevention. But this is where I see us as healthcare workers being able to step in and really participate in this conversation. Why solutions live in communities? Large healthcare systems, hospitals, they're reactive, they're limited. I know I also work in the hospital. I take care of patients in the hospital. I take care of patients in the clinic. And they're very good at tertiary prevention, keeping people from dying, keeping people from having their chronic medical conditions worsened under extreme stress or threat. They're built for acute illness. They often actually contribute to greenhouse gases. So in the United States, at least, our large healthcare systems contribute 8% of greenhouse gas emissions in our nation. So way more than aviation. People harp a lot on taking flights and feel like they're contributing to global warming by getting on an airplane, but actually our hospital systems are contributing 4 times as much as aviation globally. The infrastructure often fails during disasters, so hospitals also become at risk during extreme weather events. It's really not the place to try to be the source of solution for these issues, and they reach too few people. Even in the United States, we've had terrible, terrible health equity, very poor access to high-quality medical care for a lot of our nation, particularly in rural areas. And with some of the policies that have passed in the United States, we'll probably see a lot of our rural hospitals closing down, which is only going to stress the American health system even further. But our communities, our smaller communities where we eat, play, live, love, know our neighbors, this is where we can be proactive and adaptive. There can be early warning and surveillance through community health workers and clinics. Oftentimes, it's the primary care clinics and the community health workers that are on the front lines and start to pick up on things going on in the community well before larger health systems can be aware. They're much better at prevention and outreach through cooling kits, hydration, mobile care, cultural trust. Oftentimes, our community health workers are our family members or our neighbors or people we've gone to school with. We've known them our whole lives. And when they're coming to us to help us, they frame messaging around shared values. I find that oftentimes people will entrust very critical information to our community health workers before they'll tell a physician, because it's like talking to a peer. So we have a better sense of what's going on with somebody when we've got community health workers embedded in our care teams. Community health workers can help with integration with housing, food, and water beyond what hospital systems can provide. And this can be scaled globally, and it already has. We know that many places in the world rely exclusively on community health workers, including in Alaska where I trained. A lot of the native villages have health clinics that are run by community health workers that are in contact with physicians that are based in Anchorage. And Alaska has been doing telehealth and telecommunication for 30 years before it became the new thing. There's been rural, and I'm sure people on this call can relate to this. Places have been doing telehealth for a very long time. It just hasn't gone to scale the way it is now. So risks are local and daily. And looking at our homes, our works, and our school, this is where prevention starts. And again, I talked about trust and reach. People talking to you in your own language, culturally relevant, rounded outreach to people. This is something that large systems miss, but local communities can do with each other and provide for each other, and often teach at scale to other places. Working in local communities, you can go speedier. You can take earlier action. It's not a bumbling, slower process of larger government or hospital systems that often take a really long time to get things done. So local networks spot hazards and symptoms before hospitals can surge. And it's equity by design, because oftentimes these centers with community health workers, they're rural. They tend to operate on a tight budget. They're often, the community health workers are indigenous within indigenous communities. Also, again, trust, reach, in language, culturally responsive and appropriate. And this is cost effective and scalable. You know, we have huge improvement in health outcomes when you're looking at communities that are served by community health workers. This has been published data in the Lancet. It's in the IPCC, which is the international, it's the huge climate report that comes out every year. And Alaska, as a state, has been publishing this data on the importance of community health workers for the overwhelming health of Alaska itself. And then within this, there's system resilience. You have upstream protection that reduces surge on larger healthcare systems because we're already dealing with it at the local level. And so here's more information on community health workers and their frontline roles. This I've pulled from literature, but also this is what we're doing in Central Oregon. Central Oregon is at huge risk for wildfires and has terrible air quality during summer times. And we are heavily reliant on community health workers to help patients in these areas navigate. People in these areas also don't believe in climate change. And so part of what I'm teaching is language to be used as a clinical tool, how to not alienate people based on politics or language, but to draw them into the health system to protect their health, because the goal is really bonding and protecting people rather than getting people to think the way you do. We also want to understand, what do people think? We want to be curious about that so that we can meet people where they're at and figure out ways in which we can work with those communities to build long-term relationships of trust to keep people safe. And so here's some more information on what makes community health worker programs effective. I feel like I'm really banging the drum on community health workers here, but I really believe in it. And I feel like we've got the data to support it and lived experience. Now, this is very United States based right here. Medicaid is a US program. I probably should have put more global programming in here, but this is really based on my own lived experience and what works here. For the global framework, we've got 4 levels for community-centered climate health system. Level 1, community assets. So our community health workers, community-based organizations, our faith groups, our local government, mutual aid, schools, and employers. Level 2, primary care and local public health. Risk stratified panels, basically, you know, your list of patients, and you're looking at your patient list and saying who is most at risk based on social vulnerabilities and medical problems that they have. And we think about climate-informed pathways to taking care of people. And I would actually just like to see these climate-informed pathways as just one data point in all of the other things we're thinking about as healthcare workers, so it becomes embedded within our thinking and health system and not a niche point of view that we're saying, oh, what about climate change? We should think about that. It should just be a part of our global conversation on overall picture of health for people. And so with that, how do people access pharmacies during extreme weather events? Because what we find in Oregon, for example, where I live, is we get disaster islands where extreme weather events have cut off road and communication pathways into entire regions, and people lose access to their medicines. They can't get access to their clinicians. And so it becomes really catastrophic in terms of health access. And so we're thinking about, from the primary care and local public health level, how are we going to problem solve when those things potentially happen to our communities? How can we set up home-based care to help people? Level 3, city regional systems, so early warning systems to prep people for heat, poor air quality, or floods. How do you create areas for cooling and clean air spaces? If a person can't have an air filter in their home or they don't have air conditioning, can we create community cooling and clean air spaces where people can gather and be safe? How do we set up resilient power and water systems so that during climate disasters, people have access to electricity and clean drinking water? Level 4 is national and global. So this is financing and policy. These are huge, like national adaptation disaster plans, climate financing standards and evaluation, which is above what any of us can do right now, but we hope for it. And so we create these community action loops and outcomes. An action loop is assess, co-design, implement, measure, and it's an iterative process. So as you're measuring things, you're saying, you know, we really failed in this one area. We're going to change the program to do this. And then we remeasure again. And we're getting constant feedback from ourselves and from the people that we're serving about how we can be doing things better and more effectively, and then really amplifying what's working to keep it going. And working within communities long term and having them have a voice in the entire process builds cohesion and trust. It builds social capital, aligns with local priorities, because it's about protecting people. Again, it's not about convincing people to think the way you think. It's really just about meeting people where they're at, understanding their goals and priorities, and keeping people safe. Equity reaches and protects high-risk households first. So the places that are on the front lines, the people who are most, you know, they're vulnerable, but they also, in a lot of ways, have a lot of information for us to learn. They've been living on the front line of climate change for a long time, and they do know some things about how to survive this. And so I have found that I learn a ton from working with people that will tell me things I had no idea, and then I can go and learn some more and reincorporate that into educational programming. Health impacts. When we do this right, we've got fewer heat and smoke illnesses. We keep people alive. We keep communities safe and intact, and we're reducing vector and waterborne disease. We decompress the stress on larger health systems. So we avoid ED visits, hospitalizations. We're protecting capacity in large healthcare systems and hospitals. One of the things that happened in Oregon in the first year of the pandemic is the hospital was filled up with the pandemic, and then we had 3 extreme weather events. We had no hospital beds, and our emergency departments were so overwhelmed and flooding that people were actually dying outside of the hospital. And they were dying from things like lack of access to cancer treatment, things that we had all took for granted, lack of access to care for a heart attack or a stroke, because there was nothing, there was no capacity for it because we were full. And so there's this downstream effect from not planning for extreme weather events, where even just routine medical care gets disrupted, and then people become sick because of that. So it's really important to think about not stressing the entire system to a point where people will be harmed globally. And then we learn, and the more we learn, the faster we can alert and respond and create systems that are effective and efficient. And we learn from the people we are serving. The people we serve are writing their own manual in many ways on their survival, and they give us the data that we need to help serve them better. And so it's really a mutual exchange market of information. And we are not coming from a top-down expert approach, but from we want to build a long-term partnership with you and help your community. And in that way, we're also learning more from you at the same time. And then resilience and cost. So the fewer disaster losses, the better continuity of care and return on investment. I've got like 12 minutes left, and I want to leave some time for any discussion or questions. So I've got some cross-sector global examples. I've talked a lot about Oregon. We have, part of our government insurance program, some funded climate supports. It's a very small program, and we're trying to study the effectiveness of it now. In Nicaragua, they have rest, shade, hydration programs to reduce kidney injury in their outdoor workers. Bangladesh, has community-based flood warning and mobile health systems. The Pacific Islands are using traditional knowledge, so controlled burns and relocation planning. Areas of sub-Saharan Africa, community health workers expand malaria programs to deal with heat and waterborne disease. And so I have some slides that go into much more detail on these things. So the policy lever in the United States, in Oregon, there's 50 states in the United States. Oregon is one state, we're the first state to do this, but to actually put climate-related supports within our healthcare, health insurance system, and to really look at who's most at risk and try to protect them with things like air filters, generators, air conditioners, mini refrigerators for their insulin or refrigerated medications before disaster hits so that they're safe during that time. And we're reducing our hospitalizations because of that. Target certain populations that are at most risk. The core actions are really getting this equipment to people, making sure they know how to use it and that they're actually using it, and that our utility programs that provide electricity aren't overcharging people for using these things. So we have to think broadly, like our utility systems have to be on board with this, or people won't use it because they're afraid they won't be able to pay their electric bill. Why it works is we're reducing exposure to heat and to particulate matter and ozone during extreme weather events, and it's preventing heart failure exacerbations, lung disease exacerbations, and kidney failure, as well as psychological stress, climate change issues. And so the way we've been able to do that is by using our electronic health record system to flag people and getting our care management teams, which are nurses and social workers and community health workers, doing outreach and getting patients enrolled in this program. And so far it's been effective. It's small, but it's been effective. One thing to think about in the United States is there's a huge communications project that's a collaboration between Yale and George Mason University, and it's called the Six Americas. And this could actually probably be generalized to more things beyond climate change, but it puts the United States, the population of the United States, into 6 categories on how they think, perceive, and feel about climate change. And you can read through these 6 categories here. There's the alarmed, concerned, cautious, disengaged, doubtful, and dismissive. The percentages change year to year, so it's a really living project. But I think it's really important because when I'm going into a community, I can do a political evaluation of that community and see, where do most people live? Which part of the 6 Americas am I going in to talk to? And I can change my language and approach to people based on their belief systems, and do so effectively so that they are engaging with the health system to keep them protected and mitigating risks to their health. And the way that, for example, a person who is dismissive might talk about wildfire season is, it's just wildfire season, it's just happening, it happens every year, we live here. And they often know how to live in that that extreme weather event, and they'll tell you how to do it. They just don't want to hear it has anything to do with climate change. No problem. Not going to say that term at all. We're just going to talk about wildfire season. That's it. And so communicating effectively, you're leading with local leaders, people who already live in this community, who are part of this community, know how to talk to people and avoid jargon. And so it's about radical empathy. The goal is building relationships, understanding, being curious, not about changing minds. And so already gave some examples about preferred language. And, if this is helpful for people living outside of the United States and other communities where people may not be thinking about climate change in the same way, you could probably take some of the framework of the 6 Americas and apply that to other local communities to try to get a sense of who am I talking to when I go into a community development. So in Nicaragua, we've got rest, shade, hydration to prevent kidney injury, kidney failure in young men who have no other risk factors, no hypertension, no diabetes, they're not exposed to organophosphates. They are developing chronic kidney disease leading to end-stage renal disease and needing dialysis. And the thought is it's from chronic heat exposure working outside. And so They have implemented certain programs for their agricultural workers who are facing extreme heat and dehydration, and ways to basically protect kidney health. Bangladesh, it's a community flood warning and mobile health system. And so they have dense river deltas with monsoon floods and cyclones. And so they've got local volunteers, they use sirens, megaphones, they use texts and apps to alert people to flash flooding. It's been pretty effective. They rely a lot on it's a community health worker-led messaging for different subgroups of the population, like pregnancy, infants, and children. They work on cholera and diarrhea prevention. They help people with oral rehydration because, again, even when there's a lot of water, there's flooding, the water is not safe to drink. So people actually are at great risk of dehydration. So it's another pretty effective program. The Pacific Islands are using traditional knowledge for risk reduction. So again, this is a community-led practice, and it's stewarded by community health workers as well. And so it's interesting because it's similar to a lot of the issues that are happening with native villages in Alaska, but they're having to do large scale village relocations and elevation of homes and community assets. But when it's led by the community itself, it strengthens social cohesion and legitimacy. It's preserving ancestral knowledge while incorporating modern hazard data. And we have found that communities that are following this pathway are developing more psychological and health resilience than if there's just sort of a slapdash, unprepared, we have to move you, and it's coming people from outside of the community coming in to move people. And just we're able to preserve culture, language, people, and knowledge. Community health workers in sub-Saharan Africa working on malaria and heat and the reduction of waterborne risks. So I feel like this has been a community health worker driven agenda in parts of sub-Saharan Africa for many, many years, and probably could be teaching the rest of the planet how to do it effectively. And so they have linkages with two-way referral systems to primary care. They are using CMS reminders and text message reminders. There's outbreak surveillance with rapid feedback to districts so the districts can respond. There are heat registries, wellness checks, cooling and hydration advice, distribution of fans and masks where feasible. There's household wash education and point of use water treatment, diarrheal disease prevention. So a lot of really cool stuff. And lessons and call to action. Got 3 minutes here. So lesson 1, communities are on the front lines of health resilience. Lesson 2, large healthcare systems and hospitals cannot solve climate health issues alone. Lesson 3, global collaborations must fund and elevate local interventions. So I'm going to, let's see, I had questions. I'm thinking that we're not having time for the questions because we've got 3 minutes and I want to be able to hear from a few of you. I've listed some global resources so that if you're interested in any of these things, you can look further, and then some follow-up actions to think about what you can do in your own community. And thank you. That's my daughter. That's Oregon. Appreciate your time.
Wow, that's wonderful, Leah. Thank you very much for this great presentation on climate change. And yeah, as we learned, climate change is a real threat to global health. And as we learned that, each continent really faces different risks such as heat, drought, flooding, sea level rise, and all those kind of infectious diseases. And yeah, it's really great. And I really think that communities are frontline, like to, uh, like for early warning, outreach, trust, and scalable solutions. And as health professionals, it's really important to integrate climate to health screening, provide counseling and the prevention into our daily practice. It's very important. And I saw a couple of questions. Yeah, so we can just take maybe like one question. So Sylvie, can you ask the question? I see in the chat here. Like my question for Asia, what measures are being taken to help countries adapt to increasing heat waves and drought in Southwest and Central Asia? So do you see the question in chat box?
I wish I was more of an expert on Asia than I am, but I will say that in South Asia, in urban centers, people are increasingly just living inside during their summer weather and during extreme weather events. And in Central Asia, I think from what I have learned, mostly from going to conferences and talking to my Chinese colleagues, they are experiencing a lot of the erratic heat that North America does, where areas that had been continental or temperate are of a sudden experiencing a heat dome. And so they're using a lot of the same strategies that we are, which is creating cooling centers. Not everybody can afford to have air conditioning, so they create community spaces where people can gather and stay cool and sleep. That's happening across China. And I know China is really leading at this point globally on climate solutions and building sustainable housing. I don't have as much information about it as I would like, but that's what I've learned so far. There's probably a lot more detail than I have, but I hope that answers some of the question.
Okay, any other question? Question, please.
Something about Africa and everything that I have learned and put into this slide on Africa, I learned at the World Health Summit from people from Africa who are there and talking and just truly blowing my mind, because what they understand and the solutions they're bringing to the global stage is above and beyond, I think, some, like, really the rest of the planet. And the thinking around the health leaders coming out of Africa has really, in my mind, is the basis and foundation for the One Health movement, which almost everybody outside of the United States is embracing and moving towards. And so if you really want to get in on the know, try to come to the World Health Summit, where you will hear leaders from every country in sub-Saharan Africa showing up with solutions that if we listen to them, this would be a non-issue. We could do this as a planet, right? And the way that they think about things is beyond just human health. They are thinking about how we live with our animals and the impact on animal-human relationships and our ecosystems and our urban landscapes. So I'm not an expert on it. I've literally poached the information from these global leaders that show up to these summits and talk.
Okay, so if there's no other question, thank you very much again, Leah, for this wonderful presentation. And I really appreciate your time and the time for everyone who was able to attend this first webinar, and looking forward to, having more webinars and learn more about global health and how we can really, help our communities. And yeah, again, thank you very much for your time. Really appreciate it.
Thank you.
Okay, thank you. Bye, everyone.
Thanks very much. Bye.
Thank you. Bye, everyone. Thank you.
Bye bye. Thank you.